Welcome to our mnemonic video on cough differential. Let's get started. This scene will take place at a casino in Las Vegas, Nevada, and will help us learn about the differential diagnosis for cough. One of the gamblers coming to play is not looking so good. As we can see, she is experiencing quite a coughing fit, and she will be our reminder that this story is teaching us about the differential for cough. Now, where is the fabulous Las Vegas sign? Here we can see the landmark sign, Las Vegas, full of gambling, sex, and alcohol. It's commonly known as the Sin City. It's even written here on the sign. Notice that Sin City sounds like sinusitis, a cause of cough. And this condition usually presents with copious green discharge, much like the symptoms of our sick gambler. Sinusitis is most commonly caused by viral infections, like rhinovirus and influenza virus, and the most common bacterial cause is strep pneumoniae. This lady with sinusitis was just about to sit on this gambling table and try her luck. So let's see who else is down for that. To the left of the table, we see another gambler has taken a seat to test his luck. It looks like he planned to stay for a while and eat while he plays. Notice that he has brought a tray of potatoes, which are tubers. Tubers sounds like tuberculosis, which is a mycobacterial infection transmitted via respiratory droplets. Tuberculosis often presents with hemoptysis, much like our gambler here, who's holding a bloody tissue. TB is a cause of cough and can be active, latent, or miliary. Latent TB is detected with a purified protein derivative skin test, where a small amount of the mycobacterium protein is deposited under the skin, and a wheal formation indicates a positive test. Now let's see why this guy has taken that seat particularly. The tuber-consuming gambler chose that place on the poker table to get warmed by the fireplace, which we can see behind him. Notice that the fireplace has a raging smoky fire inside with a long, pink chimney rising above it. The chimney is round and pinkish, much like the mucosa of the esophagus, and the fire below should remind us of heartburn. Patients often complain of heartburn after eating as a major symptom of GERD, which is a common cause of cough. If we look closely, we can see the smoke from the fire is causing the bricks of the chimney to turn from pink to black. And that should remind you of esophageal metaplasia, also known as Barrett's esophagus, which occurs in the setting of chronic GERD. Barrett's esophagus occurs when the squamous esophageal cells transform into intestinal columnar epithelial cells. This condition is concerning because it's a precancerous lesion that can proceed to esophageal adenocarcinoma. All of that smoke, though, must be causing some other problems inside the casino, besides suiting the chimney. So let's take a look. The excessive smoke is causing this employee here to cough like crazy. Notice the heat is raising his body temperature and making him sweat, much like a fever. Coughing, sweating, and fever are all symptoms of pneumonia, which is another cause of cough. The most common bacteria causing pneumonia is Streptococcus pneumoniae, but many other bacteria can also be culprits. For example, aspiration pneumonia is most often associated with anaerobic bacteria, while HIV patients are at a higher risk for pneumocystis pneumonia. Although the fireplace is smoky, it's making the place warm and luring some of the casino goers for its warmth. So let's see who else is here for a warm gambling seat. Next to our tuberman is another woman who found this place to be suitable, and now she's all set for her poker game. However, she is having a hard time concentrating due to the fireplace smoke that irritates her upper respiratory system, causing her to sneeze. This idea should make you think of an upper respiratory infection, a common cause of cough. Similar to sinusitis, upper respiratory infections are most commonly caused by viral infections, with rhinovirus being the most common cause. This poker game is getting more sad as we go. Let's see who else is sitting on this table of misery. Here we see another player who has come to join next to our sneezing player, but he's looking pretty sick with his running nose, reddish eyes, and stooped posture. The flower on his tuxedo looks to be the cause of his symptoms. And this should help you remember that pollen associated with flowers can provoke allergic rhinitis, which is a type 1 IgE-mediated hypersensitivity reaction and a common cause of cough. Allergic rhinitis is treated with antihistamine drugs and avoidance of triggers such as pollen and animal dander. This table must be the worst gambling table in the world, but let's see who else is here for some gambling. As the game progresses, it looks as though one of the players is not happy about his repeated loss. He should have expected this before sitting on this unlucky table, but now he's ripping up the ace of hearts in an angry fit of rage. Anyway, the ace of hearts should make you think of ACE inhibitor, a drug used to treat hypertension and a cause of dry cough. ACE is part of the kinin-kallikrein system, which degrades bradykinin to inactive metabolites. Therefore, using ACE inhibitors will lead to excess bradykinin, which causes the chronic dry cough. Sometimes it's hard to tolerate the dry cough, so switching to angiotensin receptor blocker drugs, or ARBs for short, like losartan, would be a perfect alternative. This enraged poker player ripping the ace of hearts was about to get violent, so someone called the police. However, Nevada police must have been busy elsewhere on the trip because it's a Colorado Police Department officer who showed up. Notice that he uses his inhaler as he is overwhelmed by all of the sick people. Colorado Police Department, abbreviated COPD, should make you think of chronic obstructive pulmonary disease, or COPD for short, which is another common cause of cough. His inhaler should remind you of asthma, another obstructive pulmonary disorder that causes cough. And with that, you now have everything you need to know about the table of misery story and the differential diagnosis of cough.